Hi, this is Joe Bonnier for FastPitchPower.com, and today I'm going to give you a brief tutorial on lower back injuries in softball athletes. First, I'm going to explain what I feel is the most dangerous movement for a softball player, and then explain where exactly that occurs during softball-specific movements. I'm going to give you a biopsy of my assessment that I use with my athletes to determine whether they're kind of at risk for this movement to occur during their sport. Then I'm going to give you my most valuable corrective exercise strategies, the ones I typically go to the most to lengthen and strengthen specific areas of the body that are going to prevent this movement from happening too often, during softball. The movement that I believe leads to the most harm in lower backs of softball athletes, is too much lumbar extension. To test that out, to test whether your athletes really have a preference to use extension during more functional movements, what you want to do first is get them on all fours, and have them arch their back as much as possible. This is really assessing extension through the spine, their extension capacity. All right, have them round as well. That's testing their preference for flexion. Extension 1, flexion 2. What you're looking for is really symmetry between flexion and extension movement capacity. More often what you'll see is a preference for extension. Your athletes will have a very easy time collapsing into too much lumbar extension. When I say lumbar, I'm speaking specifically of lower back, and then they'll actually struggle to show you or demonstrate symmetrical flexion. And when I say it's symmetrical, it won't be perfectly symmetrical, but it should look about even. It should look controlled on both sides of neutral, neutral being their starting position on all fours. That exercise can be called cat-camel. Again, you're going to have your athletes extend their back, then round their back, see where their preference for movement is. If it is into extension, that athlete is more likely at risk to utilize or to exhibit a little bit too much extension during more functional movements. Not always, but most often than not, and especially in female athletes. That test is briefly assessing mobility or movement, just really movement through the spine. More important for that athlete is control. If you look back on my previous video blogs, I talk a lot about the role of core stability in softball-specific movements. I don't just preach the importance of it. I actually demonstrate where or how it benefits softball-specific mechanics. All right, the second half of your in-home assessment now for your athlete is going to be a stability test, and that's simply a front plank. Now I'm going to show you what to look for when you're assessing your athlete's tendency for extension. In a front plank position, you're going to start by having your athletes pull their face away from the ground. Their back should look relatively flat or relatively straight. You want your athletes to hold this position, and you're going to examine how long it takes them to begin to compensate and lose stability, especially in their lower backs into extension. You're going to see they'll start in a nice, strong, stable position, but at a certain point, their butt will stick up, their head's going to drop forward, and they're going to extend through the lower back, and they're going to lose the ability to control and to remain stable. The worst case scenario now is that you have a super mobile athlete, a super flexible athlete with no ability to control that movement. Now, with a lot of girls, naturally they're going to have a predisposition for good mobility, good flexibility. It's more important that they can control that in the front plank position. Now, in softball, extension occurs, or really dangerous extension occurs, I believe, in two instances. First, speaking specifically to pitchers, in fielders, okay? During the pitching sequence, as a pitcher propels themselves away from the rubber and their arm begins to travel overhead as they track, okay? 2 or 3 things are going to lead to too much extension in this lower back area, all right? One is power out of the hips, okay? If my body doesn't sense I can't adequately drive away from the rubber utilizing my hips, utilizing my glute, especially off the drive leg, okay? My hips get stuck, they get left behind, and I begin to compensate through my lower back. My belly and my chest come forward. I hang out in this position. Okay, so instead of really driving away off the rubber using my legs, okay, they actually get stuck, momentum stops, my hips stay behind, okay, and I begin to extend again through this area. So, consequently, a restorative strategy to prevent the extension here is to get strength into that back glute, as you'll see. Now, second way is just general weakness in this area. All right, weakness to control and to remain stiff as I'm moving away from the rubber. Third thing is tightness in the upper back. Okay, your spine has, all right, different segments. If the segment on top of the lower back, which we refer to as our thoracic spine, right, which is in which all of our ribs attach and our shoulder girdle attaches into, if that's not flexible into that same movement extension, if that specific segment, all right, can't extend, other segments, meaning my neck, the segments above and below my neck and my lower back, are going to compensate, and I end up with this forward head posture, forward chin during pitching, and a belly that's protruding, because my upper back is stiff. Now, I still get my shoulder in the right position because I'm compensating through my lower back. Okay? Your athlete's going to know that I need to get to, say, to 12 o'clock, right? Just slightly away from my ear. Okay? So all athletes have to get in the same position, right? I'm not speaking very technical terms, but just observing an athlete. Every athlete needs to get to about here. Okay? I can get here through pure, authentic motion at my shoulder and my upper back. Okay? But if I'm stiff in my upper back and my shoulder, and I can only get through here while my core remains stable, I have to lose stability here, okay, to then do this. All right? So I can either get motion through my shoulder, okay, or my shoulder knows it's going to get stuck, and from here, I actually get my shoulder to 12 o'clock by arching back and getting too much motion through my lower back, all right, into, again, extension. So we have tight hips and a weak butt can be the cause of getting too much extension. I have general weakness can be a cause of getting too much extension, or tightness through my upper back. And you can see if my shoulders, again, if my upper back can't extend here, all right, I'm going to lean back actually through my lower back. My head's going to protrude forward because everything's moving away from the rubber. I end up in this position, which is not good. Now that tightness in the upper back comes from bad posture. It comes from too much sitting. It's like a heavy backpack posture. This gets reinforced all too often. It's general, like, just laziness and lack of postural control and postural awareness. It's very common. All right, so that's an insult to your athletes, but it's very common. So one of the things we look to do is to improve extension and good posture and mobility through the upper back, which takes the mobility responsibility off of the lower back. This can now remain stable because I have sufficient movement through my upper back. Okay? Second instance, in softball, I'm sorry I'm demonstrating everything through my knee, on my knees here, is, all right, during hitting, movement into the ball, and then especially during the follow-through, as you can see, is that if I don't get my hips around and underneath me, all right, if I don't have sufficient mobility through my upper back, all right, to let my hands follow through appropriately, all right, I'm going to get stuck here, and then I'm going to extend through my lower back with this high dramatic follow-through, which is coached often, and it might be correct technically, or the right technical emphasis, but an athlete who doesn't have the right capacities in the specific segments of the body is going to end up compensating through here. And again, the tendency, the susceptible direction of movement is going to be extension through the lower back, too much extension. You combine hitting, all right, throwing, and that kind of sequence, that common sequence of weak, weak or tight, weak, and then tight up top. You have a pretty clear recipe for some lower back issues.